This is Dr. Hausinger, and today we're going to be talking about empowering clients through group work, Chapter 6, in your substance abuse counseling text. This is a particularly favorite subject of mine because group work is a lot of fun from the counselor's perspective. It can be very energizing if you like to work with groups. Um, one of the interesting things about groups is that it's a microcosm or a petri dish of the rest of how our lives are going. So we can practice skills within our groups and then learn those skills and then take them home and practice those and incorporate new skills within our lives. And the other nice thing about group work is, especially when we're working with peers, people have a tendency to know the behaviors and to gently confront when it is appropriate. But we might be made aware of things and habits that we have that we weren't aware of before through being in the group process. So learning objectives are to differentiate between group and individual counseling approaches, enumerate the essentials of the group counseling format, identify group models and types in the context of substance abuse counseling, understand the critical nature of multicultural perspectives in group counseling, establish ethical guidelines for group counseling, and clarify benefits of group counseling approaches in treating substance use disorder. Well, first off, there are many different theories and schools of counseling. We have psychodynamic counseling, feminist, narrative, Gestalt, existential, humanistic, person-centered, cognitive behavioral therapy, and all of these have individual counseling as well as group approaches. Generally, in chemical dependency, we are understaffed and underfunded, and so as counselors, we don't usually think about budgets, but we need to when we're working within a system, even if we feel constrained by that system. And one of the things that's very helpful is cognitive behavioral therapy, because it is not only evidence-based in a positive manner, but is effective within as little as 12 sessions. Okay. So first off, we need to make sure that our clients are fit to be in group. If clients are in acute psychiatric crises or for certain personality disorders or other disorders, clients might not be able to be in a group setting until they have acute therapy. The lengths and times of groups are going to be different. If you're at Western State and you have somebody that lives there and they're there every day, groups might be 30 minutes long because of medication and just functionality of the members. Whereas intensive outpatient groups, for example, could be 3 hours 3 times a week, or 2 hours 4 or 5 times a week. So it really depends on where we're at, as well if we're in a psychiatric hospital or if we're in intensive inpatient or intensive outpatient. Okay. Great. So this book really, and I feel like our department's orientation is strengths-based as well, and so our book really looks at the old paradigm versus the current paradigm, where we might have had a more confrontational counseling style in the past and used the group to confront. You could think of a scared straight perspective, perhaps, or, well, admit you're in denial, that type of thing. And there's a difference between compliance, where people are falling in line to gain acceptance, and internalization, in which the person is taking the information, applying it to themselves, and then making behavioral changes. And so we don't want compliance out of fear. We want internalization, because that's where behavioral change is going to be. Okay. Now, when we look at groups, we want to, just like with individual counseling and motivational interviewing, have a collaborative relationship with our clients. So group structures are based on collaborative style. Interventions support clients' movement towards change. Clients develop personal skills and strategies that are transferable to other settings. and the group leader models supportiveness and multicultural competence. So modeling is really important. If you have group rules on punctuality, you better be early. If you have rules about being on your cell phone, you shouldn't be on your cell phone. Right? So you need to model the behavior that you expect of your clients. Right? Right. In collaborative and empowering groups, all group members are recognized as having something to offer in an atmosphere of shared leadership. Group members participate equally in decisions about the nature of the group process. The counselor, as a group leader, models a respectful and supportive demeanor, and the counselor appreciates the strengths and experiences that each member brings to the process and encourages participants to acknowledge one another's strengths. And so, especially if we're all in the same group for 3 months or so, you're going to be seeing people transform and change, and leaders emerge, and allies form. And the group process, in and of itself, is a fascinating beast. Okay, so um, one of the important things is, when we talk about informed consent and do clients know what to expect, we need to establish a sense of these are the group expectations and this is how we behave. So your agency might have rules as well, but then if you're going to be in a group setting, the group can form their rules. So, for example, group members can swear but not at one another. Okay, so when you have a new group of people, it can be helpful to say, what rules do we want to have for our sessions? And every once in a while, we have to go over the rules again, read them through, etc. But this really helps people feel that they are part of the group, and it's not just, oh, I have to be here and the group leader is telling me what to do. No, you're creating a space and you're creating an atmosphere and a group culture. Right? And most outpatient groups, and we're going to talk about groups later on, are kind of a mix of psychoeducational, but also lecture and skills building. And many groups have a format for, we're going to check in and say your name, your last date of use, how you're feeling today, your daily high, your daily low, something that you're working on, etc. And as a group leader, you can customize that as well. And I like to add superhero questions and fun questions like that as icebreakers. Okay, so we're going to look at group models, the importance of multicultural perspectives, and go from there. Okay. So as I said earlier, group counseling allows us to practice skills and then we'll learn skills first, practice them in group, and then take them out into our outside of group lives and practice them there. Okay. We learn new skills, we get to practice the skills, we receive feedback from the counselor and other group members, and we learn about new behaviors. Okay. So as we go through the phases of the group, and if you ever get the opportunity to take a class just in group counseling, I highly recommend it, because there's characteristics of the different phases in groups. You have the initial stage where people might be testing the water. They don't know if they can trust you. They don't know if they can trust the group. We have the working stage where the meat and the potatoes and the real work gets done. And then we have the end stage. And sometimes we have what we call the transition stage in between those. And the ending stage is when the group is getting ready to end. And all of these have behavioral attributes to them, things that you might notice, challenges, hurdles to get over, etc. Okay. So when we say rules, we can say guidelines. Some people don't like the word rules, but it can be a great team building exercise for your group to come up with, how do we want to treat each other? Are there words that we want to avoid? And you're learning about your clients and they're learning about each other in this situation. That one in particular, rule setting, is really, really great for learning about multiculturalism within our groups. Especially if you have diverse groups, which you probably will, with ages where there might be generations and time gaps in which people's vocabulary may not be as PC today as it was when they learned it, and they might not be meaning to me offensive, but they are. So that's an important thing to do to establish, okay, what are we going to do? And then they can be altered as well as you go through that. Okay, so there's different types of groups that are commonly found in substance abuse treatment. We have the psychoeducational groups, usually a higher level of functioning. Again, if we have to make sure that the participants are appropriate for the group. The groups that you have in detox or in Western State are going to be different from outpatient groups. Okay. So these are good for pre-contemplative or contemplative level of change. Um, they provide excellent environments for introducing and practicing the principles that underlie motivational interviewing and helping group members apply the stages of change. And we can use motivational interviewing within a group setting. And your chapter goes further in depth to the stages of change. Skill development groups are usually for specific skills such as stress management, anger management, and they're usually specific to whatever that skill is going to be. Cognitive behavioral, CBT, problem-solving groups focus on a structured environment to examine behaviors. And one of the hallmark features of CBT groups, is homework. So we learn skills within the group, practice them a little bit, and then we take them out and maybe we add journaling in there and we try out different behaviors and then report back. So homework and trying out new skills and experimentation is a big part of cognitive behavioral groups. And you'll see a lot of CB groups in treatment. As I like to think that it helps connect the dots and gets to the root of that cognitive dissonance, whereas, my beliefs and my beliefs create thoughts, and then I have actions, and sometimes my beliefs, thoughts, and actions are not aligned. And so we see this a lot with decision-making groups and anger management. You made me bad, so I drink because you pissed me off. Okay, so there's a critical thinking error there. So the belief is that I have to drink because you make me mad, but therein lies the problem. You're giving somebody else power over your behavior. You make me bad, right? So then we can walk backwards and see what is really the belief there and the value there, okay? And then we get behavioral change. It's a pretty fantastic, I might be being biased here, but it's pretty effective. I find it works very well with teenagers as well. Then we have support groups. And some of these might also be peer groups such as AA, NA. Groups like this might be grief support groups for people that lose children or spouses. Okay. And many times they're peer run, but sometimes we might have a professional that leads them as well. So there's a difference between support groups and therapy groups. And that is largely with the credentials of the leader. Are we giving therapy or are we doing peer support? And your book emphatically notes over and over again that groups like AA and peer support are not treatment. They can be helpful and they can be a part of the overall recovery process, but they're not therapy. They're not counseling. Okay. And then we have interpersonal process groups, which can help clients who are dealing with trauma and violence in their past. Okay. So we might have domestic violence survivor group. In college, I took part of a interpersonal relationship group where we analyzed our patterns and talked about growing up and our relationships, and it was a really interesting thing. So there's a variety of different groups within these overall categories. So again, you're seeing this theme that we're looking at helping people change through modeling, learning new skills, trying on different behaviors, having a chance to be examined by the group, and then examining others as well. Addiction in and of itself can be an incredibly isolating and socially maladaptive, I don't want to say the word thing, process. And by going through group counseling, that takes the isolation away from it and reduces shame and guilt. And this is also very true of groups for families that love somebody with an addiction. So um, when you're going through something, it can just be very helpful to have other people that are going through the same thing. And same gender groups can be very helpful for different things. For example, domestic violence groups should be, the research shows us that groups should be separated by genders with an LGBTQ group as well. And women tend to do very well in women only group. So a group can provide us structure and discipline and can give us some order. And again, just going over this, that we learn maladaptive coping skills within addiction. Um, we can learn how to reintegrate back into society, so to speak, through the group in a safe way. All right, I'm just going to go back here for a second. The chapter really talks about the different types of groups, and again, some treatment centers are going to be abstinence only, some are going to be allowing harm reduction. Most treatment groups, the way that they're set up is they're going to ask you to do 2 sober support meetings a week, and the client can pick what sober support meetings they want to go to, whether it's Smart Recovery, Refuge Recovery, Women's Recovery, or 12-step meeting. In some cases, a client might be able to substitute marriage counseling or a personal counseling session outside of the substance use treatment with that. Um, and again, it's really important to give your clients options. Chapter 5 and 6 go over different types of recovery alternatives. And if you take the 400 class, you have that as well. And the resource is in the Moodle module for you. So I encourage you to continue to explore different groups, even go to their website if you can't go out to a group. But it's good to know about the alternatives. And most treatment centers have meetings there, even the outpatient groups. And most places are pretty open to bringing in different types of groups as well. So if a client is particularly upset with a peer support group, they can try different groups. So just to clarify, you have group counseling and one-on-one counseling, whether you're an inpatient or outpatient. And then on top of that, most agencies are going to require that a person goes to an outside peer support group, such as AA or NA. So we know that from the research that when paired with counseling, their group therapy, and in one-on-one counseling, peer support is very effective and can help with reducing or minimizing relapse. But it's not a substitute for counseling, and so it's very important that you distinguish that peer support groups are not group counseling.